my name is Ivy. I'm a Purdue Northwest nursing student, and today I'm going to be demonstrating NG insertion and removal. To start, first I'm going to perform some hand hygiene. As I'm performing my hand hygiene, I'm going to knock on my patient's door. I'm going to come in. Hello, Mr. Jones. My name is Ivy Smajak. I'm going to be doing an NG insertion on you because you have a small bowel obstruction and it is limiting your ability to eat. I will inform you that it is going to be a little bit uncomfortable, and I'm going to do my best to work with you and make it the most comfortable that I can. Can I see your ID, ma'am, please? You go ahead and verify your full name and birthday for me. Wonderful. So now I'm going to get ready to do my procedure. I'm going to come over to my bedside table that has all of my supplies ready, and I'm going to put on my gloves. This is a clean procedure, so it does not have to be sterile. After putting on my gloves, I'm going to take a towel and I'm going to place it on Mr. Jones's chest just to prevent any mess or anything similar. Then I'm going to take my tube and I'm going to measure. I'm going to start at the tip of the nose, a little bit past the nostril, just to make sure that I have the right size tube. Wrap it around back towards the earlobe, and then bring it down to about 10 centimeters or to where the xiphoid process is, which it is. So I've gone ahead and marked it with a piece of tape prior. After that, I'm going to take my lubrication and lubricate the tube 2 to 4 inches because it is going to be going inside the nose, so it needs some lubrication to work its way down. So after lubricating the tube, I'm going to instruct Mr. Jones that I'm getting ready to put the tube in, and you should go ahead and tilt your head back, and I'm going to guide the tube down and back into your nose. So it's going to be a little uncomfortable. There we go. And as soon as we feel it hit the back of the throat, we're going to give Mr. Jones a big drink of water. And then we're going to have him tilt his head forward and down and push the tube the rest of the way. Like so. After that is done, I'm going to take a piece of tape and loosely secure it to his face just to make sure before I permanently secure anything for the time being that it is not in the wrong spot. So first I'm going to take some air or some saline. I'm going to push it into the tube and then pull back out to get some stomach contents. And then test on a pH strip and wait 30 seconds to make sure that it is the correct pH. After I pH test it and do that, I'm going to attach it to suction. Alright, first I'm going to secure it to his face with my man pants so it doesn't go anywhere on me while I'm securing it to something. And then apply skin protection as needed to make sure that there's no skin breakdown on the nose. You're doing great, Mr. Jones. And then I'm going to apply suction. And then I'm going to remove the towel so I can secure the NG tube to the shirt. You're doing wonderful, Mr. Jones. This is a very uncomfortable procedure, and you're taking it like a champ. Okay. After that, I would discard my gloves, put on new pair, and now I will get ready for removal of the NG tube. To start, I would redo hand hygiene, don a new pair of gloves. After that, I will kink the tube and detach suction. And then I will take my syringe, fill it with 30 to 50 milliliters of saline or water or air, not water, air. And then flush it into the tube to make sure that it is clear. And then after it comes out clear, I will unpin it from Mr. Jones' shirt. Like so. You're doing wonderful, Mr. Jones. And then untape it from his face. Like so. I will then instruct Mr. Jones to take a big deep breath. And then as he's holding his breath, I'm going to kink the tube into this towel, and then just so go ahead and take a big deep breath for me, and pull, and then discard of it in the proper waste bin, and remove gloves, perform hand hygiene again, and that is how you do proper empty insertion and removal.